So sometimes infertility is never-ending journey. We see patients who are having repeated IVF failures. So how to combine the science and emotional or human part of it? How to support our patients better?
You've got to be very honest with the patients.
Yes.
I mean, and it very much depends on their characteristic. If the female partner is, certainly if she's over 40 and the number of eggs has gradually gone down,
Right.
or you've had a few fertilizations, then you've got to be honest, because otherwise it's just putting them through further, it's like a further punishment where you know that the success rate is going to be so.
Yeah.
I worked in Israel, where the number of cycles there is unlimited,
Yes.
which I thought was wrong.
Yes.
I don't think it was fair to the patients, although the IVF centers were making a lot of money. I think in some parts this is not the way to do it. So I think the key word is honesty.
We got to be honest with the
You're
patient.
the doctor.
Yes.
The couple will usually always be optimistic and want
Yes.
more. I think you've got.
So it's very fine balance between being honest and supporting the patient emotionally, even for consecutive attempt.
I think in some cases, being honest and saying no more will also be a relief
To the patient, and they've tried their best.
Let's not kid ourselves. IVF is not easy.
Yes.
It's a difficult procedure, not just physically, but emotionally. And I think most couples will be grateful if you are absolutely honest and say, look, this is not going to work.
Yes.
And I think that is the most important thing, rather than any psychological support that you can give. If you tell them the truth, then this is almost certainly the best way.
Even for the IVF success, I think the entire team, including the lab and the success rate of the clinic, matters a lot, because like there are many IVF clinics, but the lab standards or the clinician or the skills or the expertise, that will also make change in the success rate. So, sir, how did you find our lab?
I was extremely impressed. First of all, by the friendliness of everyone.
Thank you so much, sir. Thank you.
That is very impressive. Secondly, the whole layout of the clinic is as good as most of the ones I've seen in the UK. It's clean, it's friendly, it's well organized.
Thank you so much. That's like a very big compliment for us.
It's also, after talking to the embryologist to see how well equipped they are,
Yes, yes.
very impressive. And I'm not just saying this as a visit, I really mean it.
So actually, how many percentage of labs in the UK will have RI witness or electronic witnessing to prevent gamete mismatch?
I think most of them in the big centres will have, but there are still a few, mostly in the outlying areas, that don't have. But again, I'm as a clinician, I'm not an expert on this, so but that's about right.
So with the number of cycles increasing because of infertility rise, I think it's a good, valuable addition rather to the clinic.
Certainly, yes, yeah, very much so.
I want to know from you, because in India, polycystic ovary is very common. So how to handle the patients who are struggling with PCOS? They have tried the diets, they have taken the supplements, adjuvants, but still they're still having irregular cycles, are struggling with even fertility issues.
Well, first of all, I'm going to make myself unpopular. I'm not a big admirer of all the various dietary supplements in PCOS. I don't think.
Most of the patients think that if they take the supplements or just do the diet, it will cure the PCO.
Research-wise, just nothing has been proven. That's number one. So I don't bother with them at all. Secondly, I will, if the female partner is overweight, I would encourage her to lose weight.
Yes, weight is.
For me, I'm not going to. Certainly in my practice, I wouldn't say, look, if you get your weight down to this, we'll start treatment. I don't think that works. And I don't think it makes such a great deal of difference in the actual results for pregnancy and the live birth that you get. Mm-hmm. So I would encourage them to lose weight, but I wouldn't delay too long in starting treatment with the oral ovulation induction with either clomiphene or letrozole, which has superseded the clomiphene. If that doesn't work, after 4 to 6 cycles, then go on to your second line, which for me is low dose FSH,
Okay.
which I would also give for 4 or 6 cycles.
Okay.
The vast majority will already be pregnant by that stage.
Letrozole actually gives good ovulation even with the
Yes.
oral medication.
The ones that are left over, you've got the choice of going either something that I like, which is laparoscopic ovarian diathermy, if they're suitable.
When would you advise to go for laparoscopic?
Preferably if she's of normal weight with a high LH
Yes.
and has been infertile for less than 3 years.
Okay.
Those are the ones where we get a great deal of success with laparoscopic ovarian diathermy. And here I've got something new. Watch this for publication. We presented at ESHRI
Okay.
a way of doing ovarian drilling through the vagina. So that obviates the need for a laparoscopy and a big operation. The other alternative, of course, if nothing else has worked, is IVF. But as I said before, IVF for PCOS should be a last resort. There are clinics that will take women off the street with PCOS straight to IVF, and I think this is not good practice. It shouldn't be done because the success rates of the easier treatments are high, and there's not many syndromes you can say causing infertility that we have the success rate in PCOS.
So with the number of cases that we handle here in India, and we tend to depend upon the evidence from the US or Europe for practice, how important is it to have our own data and research to improve our clinical practice for our own patients?
I think it's absolutely essential. And the big advantage you have in India is in numbers, which other countries don't have. You're modern in the vast majority of methods that you're using. So research for you, I think, is vitally important. When you look into the past of new interventions in IVF or in infertility, it's all come out of research or being verified by research. And I'm not sure that I've seen a lot of original fertility research coming out of India in the international journals where you have the opportunity to do it, which is really one of the reasons why I'm here to try and encourage this, because I think it'd be a wonderful opportunity and not to miss it.
Yeah, that would be really great help actually. And we have been into this since last 1.5 or 2 years. We have been trying to publish papers and represent ourselves in international conference. Last year, ISWOG conference in Budapest, I presented one paper on transvaginal ultrasound for transperineal ultrasound for vaginal septum. And then our other consultants, they presented Tokyo Aspire, they presented few papers. So we are getting into it, but definitely with your help, it will be a good vision to move forward for research with our own data.
Let's do it.
Our patients will benefit, yes. So what is your opinion about current IVF situation in India? Because the infertility is on rise and many IVF centers are coming up. The quality of care that we give to our patients or...
Well, I counted up the other day. I think this is my 14th or 15th visit to India, usually for meetings or visiting centers. And over those years, and this goes back to the early 2000s, then the more I've seen, the more the level of treatment has gone up. And this is very impressive. And seeing a clinic like this today is
that's a compliment, so thank you.
Well, I'm not just saying it. I think it is well deserved. It's very impressive, and I'm sure your results will carry on going up as well. I mean, 80% on the board.
Yeah.
Very good going.
Thank you so much, sir. So technology-wise, like even in India, we are doing PGT for genetic testing of the embryos. We are the failure patients, IVF failure patients. Also, we are offering immunological treatments or even genetic testing of embryos, as I mentioned. So it's all helping along with our labs, which are
Of course, yes.
equipped with.
You're up with any other country than I've seen.
That's a compliment. So thank you so much.
You're up there.